We thank you for staying tuned. It is still the conversation, and thankful, and we are glad that our guest is here with us. There was a little delay because of the traffic. We are hoping that the road will be cleared before I go home, because I don't want to sit in that traffic. But today on the show, we'll be taking an in-depth look at the progress made under the Themes Plus agenda of Mr. Governor Babajide Sanwo-Olu, focusing on the health sector. Joining us is Dr. Mrs. Kemi Oyeyemi, the Special Advisor to the Governor on Health in Lagos State, and she'll be sharing key initiatives, achievements, and ongoing efforts aimed at improving healthcare delivery in the state. Dr. Oyeyemi, it's good to have you again here.
Thank you for having me again.
All right, let's begin this conversation with you sharing some significant milestones that has been achieved in the health sector.
Okay, so as you mentioned, Themes Plus agenda, the H meaning health and environment. Mr. Governor Babajide Sanwo-Olu has made a lot of strides in achieving what basically he wanted was in the health agenda, to give the citizens of Lagos access to quality care and affordable. So we start. So how I'll start is, if you look at what stops people from getting good health care, so we call them the social determinants of health. It's things like transportation. It's things like the cost that keeps on rising. It means they don't have the means. They don't have jobs. So everything, when we say health, it's actually totality of the whole government administration strategy. Mr. Governor said, he has a vision of what he wants for Lagos, and there has to be a strategic plan to achieve that, because without that, like he said, you're hallucinating. And I really love that. It's like, you have a vision, you have to have a strategic plan. Otherwise, you're just hallucinating. In other words, you can't make it. So when it comes to health, what he's done is, and I'll divide it into infrastructure, human capital, and what he's done. So let's start with infrastructure, because that's the main thing, big thing that's going on now. So we can start with our primary healthcare facilities. We've built more primary healthcare facilities. The primary healthcare has been divided into 6 districts, so that we can actually ensure that we make decisions as to per district, districts 1 to 6, what is peculiar about those districts. And the districts are led by permanent secretaries. And so we've built more primary healthcare facilities, the 3 more comprehensive ones coming up. Then when you look at the secondary facilities, a lot of infrastructure, a lot of refurbishment, some of the hospitals, we've done about 12, 14 hospitals where we've, for example, we're building Ojo General Hospital. They're going to have a fantastic hospital. If you look at Massey General Hospital, that's a 150-bedded hospital that it's almost over. He visited it. We're like 85, 90% done. We're also building a 1,500 bedded psychiatric hospital in Ketu, Ejiri, which is the first. The Massey is going to be the largest children's hospital in sub-Saharan Africa. And then we're looking at expanding even areas that already exist. So for example, in Lassuth, there's an oncology center there that we're looking at a PPP to expand it so that it can have radiology. Having said that, we're also looking at starting a comprehensive cancer center, which has been approved, and we're just breaking ground on that. So infrastructure-wise, we've got all sorts of things going on. When you look at human capital, we've trained a lot of healthcare workers. In other words, giving them more skills, and that's an ongoing thing. It's the whole year, and so Mr. Governor has approved a lot of training programs. We also, I just need to mention that also we're encouraging people to come back, because people do want to come back, but they want the environment to be enabling for them to be able to come back, and that's where Medipack comes in.
I was going to talk about.
Yes, I know you were going to ask that. So we'll leave that on the side, but just to tell you other things we've done apart from Medipack. So when it comes to human capital, look, we know a lot of people are leaving. The Japa syndrome has hit everybody. And so now we're, in Lagos State, we're going to have our own University of Medical and Health Sciences, where we're going to be training 1,000 doctors, 1,500 nurses, 1,000 pharmacists, 500 pharmacists, and we're increasing our training program. So hopefully that will come up soon. And that way, what happens is a lot of people are leaving. We're training them, they're leaving. So the more we train, even though people will leave, the more we'll exactly will retrain. So, and then we're partnering with private practice. So it's not just government, because government can't do it all. Government can't do it all. So, and then we're trying to get to riverine areas, far to reach areas. And then, of course, you can't talk about health without universal health coverage. So Mr. Governor has passed, this summer, he passed an executive order that everybody, you, me, everybody here, have to have Ilera-Eco, health insurance, because people don't access healthcare because they don't have the money, they don't have the means, they don't have insurance. They don't have insurance because they don't have a job. And this is a global thing. It's not peculiar to Nigeria in any shape or form. So what we do is that we're encouraging people to take the insurance so that they can have access to all the things that we're doing in Lagos State. However, if you do not have the funds, if you're vulnerable, you're not working because you're handicapped or whatever, it's free. It's called EcoSha. So EcoSha is for the vulnerable, so that they have insurance, they can access. For pregnant women, Mr. Governor still has a program of free antenatal care for pregnant women all across. It doesn't matter whether you're rich, poor, or whatever, but the point is you are pregnant. We will look after you during that pregnancy. You do not have to pay for your delivery, be it cesarean section or be it normal delivery. So he's done all those things. So we can talk about Medipack if you want. That is all also part of bringing people back, investing into, it's a PPP partnership. PP partnership. It's in Awolowo Road, as you know. Last week it was the groundbreaking ceremony, and the whole idea is to, investors are coming in, build a whole medical community, and with specialized care. Because we have a lot of general hospitals in Lagos, a lot. Everybody's, opening a hospital here or there. We also have to regulate them and make sure they're providing the best quality care. And so that kind of Medipack, the PPP, so that indigenes will actually get a subsidized or even free treatment. You're getting specialists in oncology, surgical, all the things that people are going out of the country for will be right here in Lagos. And so it's going to be a big pack, and it's going to be in phases. So there'll be phase 1, phase 2, phase 3, and we're moving. We're moving when it comes to that.
So still talking about the Medipack project. So Mr. Governor also said it would promote medical tourism. So I would like you to also break that down.
So it will promote medical tourism into Lagos. So medical tourism is people leaving where they are. Instead of going out, they'll be coming in. So it's like they'll stay in. So Nigerians don't have to go to India. They won't have to go to Dubai. They won't have to go to... In fact, what will happen is, I'm sure even the hospitals that people go to in Dubai, they'll want to have an office, a hospital, or a clinic here. So people go outside the country for a lot of things that can be done in Nigeria.
And we have good hands
in Lagos. Here. We really do. We have trained doctors, trained nurses. We have the skills. We have so this is promoting it, because people will say, I don't trust. There's no trust. Basically, that's what's happening. We have diagnostic centers. So that's what Medipack is going to have, all those things in one. It's just going to be a whole like area that is all medical. So be it a diagnostic that you want. Do you want a specialist? And like I said, people go abroad for specialized care. They go for surgery that is done every day here. And so we want to encourage people to stay in, because that's a lot of money as well. And then also you don't have family around you, because we hear all sorts of stories about people who go abroad. It's not the same. And some people come back and people are seeing that, oh my gosh, I'm glad I did this in Nigeria. It saved me money. Because it's dollars or pounds. And then you have access to care. You have a support system. We speak the language. What's the point of going to... Somebody went to Amsterdam, Holland, and the doctors and the nurses were talking over him. It's like, because they didn't understand, and he was trying to... And then they'll leave, He doesn't know what the plan is, but he's sitting there and he thinks he's getting the best care. So that's a medical tourism into. So people can come from other African countries into Lagos.
And this will also boost our economy.
And it will boost, exactly, it will boost our economy as well.
Okay, this present administration has also focused on improving maternal and child care through various initiatives. Can you take us through some of the things that has been done and how this has impacted maternal and infant mortality rates?
Okay, so our maternal and infant mortality rates is improving just slightly. It's not worse than it was before, but we have a lot to do. And we recognize that. And so one of the things we do, apart from advocacy, apart from health education, the primary healthcare setting is divided into 6, like I said to you. And part of what the permanent secretaries are tasked with is to ensure that the population of pregnant women get antenatal care and all that. So what we're doing also is people love traditional birth attendants.
Yeah.
Yes.
We can't take it away
because
from the people.
even though it is free in general hospitals and primary health, they still go to the tradition. And we recognize that. And that is fine. There's nothing wrong with that. So what the government has done is, what we've done is embraced the traditional birth attendants. So we dialogue, we tell them, we educate them. When the pregnant woman comes with you, if it's, for example, if it's a first pregnancy, send them to the hospital because you do not know if it's multiple pregnancy, twins, triplets, send them to the hospital. If they're not fine, swollen legs and all that, they're not, send them to the hospital. We're not saying do not deliver. We're saying go ahead, deliver, but these are the safe ones, the simple ones, because people deliver at home.
Yeah.
Delivery is supposed to be normal, but sometimes things go wrong.
Yeah.
Don't send them to us when they're late. We've also been in contact with, or we're dialoguing with traditional rulers in the community because people respect the traditional rulers. Churches, we're very religious in Nigeria as a whole. So the pastors and the imams, we've talked to them as don't keep people in church or in the mosque. Please send them to the hospital. And of course, when they get to the hospital, we've also do customer service care because some of the mothers have said they don't treat me well, they yell at me, whether it's a midwife or whatever. So then on our part, we're also doing customer service that, you know, they've come to deliver. That's their own, they've come to deliver. And your task is to help them deliver safely and go home. Not yell at them or not be nice or
because
anything.
That's a big issue. You know.
It is a big issue because we've done surveys to see why people go to traditional birth attendants. So we do our part and we tell them also to we're also doing family planning. Yeah. Family planning is part of maternal. I mean, people shouldn't be having 6 children or 5 children, especially
they say
in this
they don't count children. No?
Well, well, if you can't afford to look after the first one, how can you afford to look after the 4th? Because the problem is, some mothers, the more they have children, the more at risk they are. Yeah. That's one. And then 2, you know, the stress and all, it's all, so you have a baby, you have the 6th child, your 4th hasn't even eaten in the, how is the 6th one going to eat? How are you going to cope with, and not only that, giving them a good life, sending them to school and all that. So the first one is going to be working with you, will not go to school. So you have a cycle where, you know, a cycle of people not going to school, not having a job and all that. So family planning, we're not saying don't have the kids. You can have 6 if you want. You can have 7.
Take care of them.
But space them out. You've got to space them out. You can't have one every year. We see them. You can't. So that what family planning is to prevent pregnancy when you do not want them.
So still talking about family planning, how far is the advocacy going? Because a lot of people still will not buy into this. There are lots of people, even in this present age, who do not believe that they should go for family planning. So how is the advocacy going?
Virtually every day. And then don't forget, we also have international partners who, Bill and Melinda Gates Foundation, Clinton Health Initiative, they're all trying to help us, assist us in bringing down maternal and infant mortality indices so that we bring it down. I mean, they help different countries because they have the funds to do it. But we keep on saying it. We're making good strides because we even ran out of commodities, believe it or not. Oh, yeah. The thing is, so I used to be a family planner at one time, and that was years ago, and I can tell you that sometimes I put in an IUD for a woman, and the IUD, you tuck in the string or whatever, and so it stays in. It's a device that stays in. The woman doesn't have to do anything, whatever. And some of them come back and say their husband has felt the string and needs to, because they're doing it in secret.
Oh, okay.
So the men also have a lot
they need to be
to help us
along.
with. And they are carried along. We're telling them that, I mean, condom is a form of contraception. And if some men don't even want to use a condom, and then they don't want their wives to use any form of contraception.
Yeah.
So it's both. It's for the man. I mean, it takes two people to have a baby. So both of them have to be involved in family planning.
Okay, I also want you to talk about the routine immunizations too. Recently, there was a campaign for that. You would still find out that some people still do not allow their children to take this thing. So how far is the advocacy also going to educate people, especially in the rural communities?
So the last one we did, which was in conjunction with National, it was extremely successful. It actually surpassed what we actually even thought we would get, and to the extent that we actually ran out of commodities, especially things like even the HPV. That was a big issue. In fact, Lagos State was actually taken to court, just Lagos State, in the whole of Nigeria, that some anti-vax people, they were there at COVID. They said, do not take your vaccination. Do not. So there's some people totally against it for whatever reason. They did take the government to court, but basically what happened was they said we were giving it without informed consent from the parents, which we have never done in Lagos State. Nobody has ever given any vaccination without taking consent from the mother. It's the mother that brings the child, or the father, any one of them. So, and we said, fine. I mean, this is what we do routinely anyway. So we started the campaign in the primary healthcare centers. The permanent secretaries worked very hard to ensure that all the health workers advocated for this. We have health educators in the primary healthcare setting, and they were overwhelmed. I can't give you the figures as to how many, but we did get to our target and surpassed it. And so we continue to do it. We continue to say immunization. I mean, look at all the childhood diseases. I mean, so it goes without saying that we have to continue to tell people that this is good for your child.
All right, let's talk about Ilera Eko health insurance scheme. The conversation will not be complete if you don't talk about it. And of course, Ekosha. So these initiatives have truly impacted the lives of Lagos residents. So can you share, we're doing a review, an update on its performance since it started? What are the challenges that has been experienced? And as we approach the new year, what's the next phase?
Yeah. So Ilera Eko, like you said, and Ekosha, I said earlier that Ekosha is for the vulnerable. Ilera Eko is in line with National, which is the National Health Insurance Act, where everybody has to have insurance. And, initially it was like, if you want it, there was no executive order. But we realized that people just didn't understand the importance of having insurance. Now, when you're a driver driving a car, you have to have insurance. It's the law. It helps you should you have an accident, then the insurance company will pay. People have life insurance. People insure their jewelry, they insure their... But there's just something about health that people feel, because people feel, I'm going to be healthy.
God forbid, it's not my portion.
It is not my portion. It is not. So what happens is, I remember when I was, even up till now, people will send you a message, Ma, please, can you help me? My wife just delivered, or my wife had somebody had an accident, and the hospital has asked me to pay 150,000, and I don't have it. So one of the first things I ask is, do you have insurance? Do you know that if you had insurance, if you had paid, at that time it was 8,500, if you had paid, your drug would have been free. You wouldn't pay for your drug. You wouldn't pay for the card. There's certain things you just won't pay for. Now you have to pay 150 at one go. So we try to tell people that this is what insurance means. This is, if you have Ilerico, this is what happens. If you have malaria, you go to the primary health care center. You do not pay a kobo because you have that card, you have insurance. So it's mandatory for civil servants. They take it out of their salary. So Mr. Governor has said it's the law. It doesn't matter whether you have Bupa and all the high-end insurance. We've told employers, give your employees, I hope you have Ilerico.
Oh, yes, we do.
You have it. Exactly, exactly. LTV has to have it. You're Lagos.
Yes.
This is Lagos. So, have your insurance, hold on to your card. God forbid you need it, that's fine. But if you do need it, you go to the hospital. This is my insurance, and nobody's asking you. You must pay, this amount of money before you even see a doctor. So we're encouraging people, and they're taking it up. They're taking it up. Dr. Zamba, who's the permanent secretary of LASHMA, she's done all sorts of programs to encourage people. She's gone out there. They're still going out there, even into the far reach areas. But we're trying to ensure that everybody has access to the healthcare, and all those things I've listed earlier are the things we're doing to show people that Lagos, the governor cares and he wants the best for you, because a healthy citizens boost the economy, like you said, and it's a healthy nation.
So in terms of enrollment into Ilerico, are there improvements, especially in the riverine areas?
Yeah, so what we're doing, so the riverine areas, for example, transportation and things like that is an issue. And we're actually working with one of our international partners in how to improve access to those places. So, even our ambulance services have expanded and improved for emergency things outside in the riverine areas. We now have the boat clinic, the waterways. We actually have one. Hopefully we'll have 2 more, so that we can go regularly to those areas. We can get people, the community, midwives, health workers, to actually go physically there for people who cannot come in, because you can tell them, please come in, or there's a bus waiting for you, or they will not come. So we're taking it to them, to the communities, and that's what we're improving on. That we're doing more, and hopefully in 2025 we'll even do more than we're doing, and we'll see people realize that this is Lagos, and we care about every single citizen that lives in Lagos.
This is Lagos, and
this is Lagos
cares about every single citizen. Time will not permit us to continue this conversation. Hopefully we can have you some other time again. We thank you very much, Dr. Mrs. Kemi Ogunyemi, Special Advisor to the Governor on Health, Lagos State, and she has speaking on the review of the Themes Plus agenda focusing on health. Thank you so much for joining us, ma'am.
Thank you very much for having me.
The conversation continues after this. Stay with us.